Hi, I'm Heather Whitmer, one of the owners here at LeBeau Skincare Center, and I'm here with Hillary Leibowitz Schaefer, the other owner of LeBeau. And today we are going to answer some questions about leg vein therapy. A lot of ladies inquire about this and want to know what the treatment options are. So thanks for being here and answering some questions. So what is leg vein therapy, and what do we do to treat those veins that we have?
Sure. So leg vein therapy is injecting into a spider vein, which are on the legs. Spider veins are the ones that are reddish purple and tend to have lots of little tiny veins that kind of sprout off of it. They're different than those bulging varicose veins.
Okay.
So we don't treat the bulging varicose veins. That's something that you really want to go see a vascular, specialist for. For the spider veins, they're created from us standing all day. It can be from pregnancies, and the extra weight that we put on our legs while we're carrying the baby. It can be from sitting and, having pressure, being with our legs being crossed or being against a chair. And over time, then those veins come up to the surface and they're very noticeable. So when the injector injects a special solution into those leg veins, it causes the vein to collapse. And when that vein collapses, it hides that vein. Sometimes they get kind of purpley after they've been injected, but it's actually very neat to watch because when the vein is being injected into, it actually will blanch and it follows the vein the whole way in all the different directions so that they know that they've actually treated it properly.
Okay.
And then it's responded to it. After you've had that injection, the important part is not to just go and stand up without any type of support and put that pressure back into that area again, because that's what kind of created them to begin with, is that pressure. So having special support hose that we will recommend to you when you come in for your consultation, we'll have you put them on right after the treatment, because that puts the proper amount of pressure so that when you stand up, we're not putting like that physical stand-up pressure back into there and forcing the blood to hit back into those veins again.
So when you say about the veins collapsing, sounds a little scary. What happens? Like, is there? Do you feel it? Is there? What happens when that happens?
So those veins are not necessary.
Okay.
They've come up and kind of offshoot and come up to the surface, and they're just ugly. I get them, so I personally don't like my spider veins when I get them. But they're not something that we need. They are just more of that superficial now vein that's come up to the surface. When we cause them to, when I use the word collapse, we are destroying that vein and making that now be underneath the surface and kind of hidden so that it's not going to be visible anymore.
Okay. So is there any pain involved with it?
You feel the little tiny needle when it goes in, but it's really tiny. It's not anything uncomfortable. I mean, you feel like a little pinch. That's it then. The solution that we use is not a burny solution. It used to be saline years ago, and saline being salt water would burn. The new solutions don't feel like that at all.
Okay.
They're very, very comfortable.
Afterwards, you talked about wearing the support hose. How long do we recommend using them or wearing them after having the procedure done?
You definitely want them at least a week.
Okay.
The more you wear them, the better. For a long term, to keep, that is one thing, like by wearing support hose all the time, you keep the pressure off of your legs so that you don't get new veins coming up to the surface. So, if you like to wear them and you're on your feet all day, you should wear them a lot. That vein will be gone, but it's not to say that a new vein wouldn't come out after that. And typically treatments will say anywhere from 1 to 3.
Okay.
And the reason for that is we might not get the entire vein that first injection. We might need to do it again, or maybe there's lots of veins in an area and we just can't get all of them in one one treatment.
And how long does a typical treatment session take?
Usually about 30 minutes.
Okay.
The injection time is anywhere from 15 to 30, depending on how many veins that there are to treat. And then till you get undressed and, you know, put the stockings on afterwards, it's usually about a half an hour.
And is there any are there any side effects or downtime involved with having the treatment done?
Only thing is the stockings, you know, that you wouldn't want to you would not want to have a tan or go into the sun right after you've had a treatment, because you're healing in that area. Not that it's a wound or anything like that, but because you might have a bruise, you wouldn't want sun to be on that at the same time. You also don't want to, I typically wouldn't want to do it in the summer, in the sense of wearing stockings in the summer. I mean, if it's really hot, now maybe that doesn't bother you, but I tend to like to have it done more in that fall winter time.
Okay. Anything else that you can think of to add that patients typically ask about leg vein therapy?
No, I think it's just nice to know that there is something that can be done. You know, there's so many fad things that you see online and in the grocery store that's vein away and make these veins go away, and if you take this supplement or you put this cream on, it just doesn't work. You have to have it truly injected down into that vein in order to have that vein go away.
And with the treatment of the injections, are there any other options for treating the leg veins?
We can do a laser treatment, but the injections are more effective. Okay. We just find that the results are much better and longer lasting having the injection done as opposed to the laser.
Okay. All right. Well, great. Well, we do offer free consultations for all of our services. So if you are interested in having leg vein therapy done, please give us a call.